Let us read about preventing acute renal failure. First one, provide adequate hydration to patients at risk for dehydration. Surgical patients before, during, and after surgery. Patients undergoing intensive diagnostic studies requiring fluid restriction and contrast agents. Example, barium minima intravenous pyrograms. Especially elderly patients who may not have adequate renal reserve. Patients with neoplastic disorders or disorders of metabolism, example gout, and those receiving chemotherapy. Second one, prevent and treat shock promptly with blood and fluid replacement. Third, monitor central venous and arterial pressures and hourly urine output of critically ill patients to detect the onset of renal failure as early as possible. Fourth, treat hypotension promptly. Fifth, continually assess renal function, urine output, laboratory values when appropriate. Sixth, take precautions to ensure that the appropriate blood is administered to the correct patient in order to avoid severe transfusion reactions, which can precipitate renal failure. Seventh, prevent and treat infections promptly. Infections can produce progressive renal damage. Number 8, pay special attention to wounds, burns, and other precursors of sepsis. Ninth, give meticulous care to patients with indwelling catheters to prevent infections from ascending in the urinary tract. Remove catheters as soon as possible. 10th, to prevent toxic drug effects, closely monitor dosage, duration of use, and blood vessels of all medications metabolized or excreted by the kidneys. Thank you.